So it's clear that there are a lot of mutations that are required to form cancer. How do we acquire these mutations that result in cancer? Most of the mutations that we acquire that lead to cancer are acquired over the course of our lifetime. They are acquired as what are referred to as spontaneous mutations. Spontaneous mutations are mutations that occur during the process of cell division. Every time a cell divides, it needs to copy 6 billion letters perfectly for every human cell that it makes. 6 billion letters, and they're just A, T, G, and C. As you can imagine, the enzymes responsible for this process cannot do this perfectly, and eventually can result in the formation of mutations, or changes to the DNA. These spontaneous mutations occur no matter what you do in your lifetime. You cannot reduce the rate of these mutations, and there's nothing you can do to slow these down. So in some cases, cancer is effectively unavoidable. However, there is a different set of mutations that are also acquired during your lifetime that are acquired from the environment. These are what are referred to as induced mutations. Induced mutations are mutations that occur either as a result of energy in your environment, chemicals in your environment, or even disease-causing pathogens. Let's take a look at some of these. The first one that I mentioned is energy. Energy in the form of UV radiation from the sun, like anytime you lay out in the sun or get some sun exposure without clothing or sunscreen protection, can lead to skin cancer, as I'm sure you know. The reason for that is because the UV radiation from the sun does penetrate just the surface layers of your skin, and there can cause small DNA mutations that can eventually, over time, lead to cancer. This affects only your cell tissue, as UV radiation cannot penetrate any further than that. However, there are other types of radiation that can penetrate many layers of your cells. This includes X-ray radiation that's used for seeing if you have any broken bones or when you go to the dental office, and the type of radiation you can get from nuclear power plants, such as Chernobyl or the Fukushima Daiichi nuclear power plants that have and are continuing to release radiation into the environment today. That type of radiation can penetrate much further than the skin and can affect many organs. It's also much higher energy than UV radiation and can cause much greater DNA damage and much larger DNA mutations than just the UV radiation on its own. However, it's not just energy that can lead to changes in your DNA sequence. Chemicals in your environment can also do this as well. There are many different types of chemicals that can lead to DNA mutations, and some of these you may already know about. This includes things like the chemicals found in cigarette smoke that can lead to lung cancer, asbestos, that if you breathe in the tiny particles when you apply asbestos or remove it from ceilings, can also lead to lung cancer. Alcohol, which is a major carcinogen that you don't hear a lot about, but when consumed in large quantities on a regular basis could also lead to cancer. There are also other ingredients that can increase your risk of cancer in a small degree. And these really you should sort of consider if it's worthwhile for your lifestyle to enjoy them. Generally, asbestos, tobacco smoke, and alcohol you should try to avoid or reduce as much as possible. But some other things like fried foods, French fries and fried chicken, burnt foods like toast, well-done meat, barbecue, or even roasted coffee, like the way that you would see cancer warnings on some Starbucks stores in California. Processed meats like salami, where they include a lot of nitrates. Even things like cell phones, peanut butter, products at a salon, like a hair salon. Many of these things can increase your risk of cancer in small amounts. But because it increases your risk of cancer only in small amounts, you should really consider to yourself if using a cell phone is worth the tiny, tiny risk of increasing your risk of cancer or not. Many people would think that it is. There's also some new evidence that other things that can lead to DNA mutations include disease-causing pathogens. This is especially relevant for HPV, or human papillomavirus, which can cause cervical cancer. A vast majority cases of cervical cancer are caused by this virus. So many, in fact, that pharmaceutical companies have developed a vaccine against HPV, which is essentially a vaccine against cervical cancer. Similarly, hepatitis can lead to liver cancer. And hepatitis leading to liver cancer is the second most preventable cancer in the United States. The first, of course, being lung cancer if you just stop smoking. All of these can increase your risk of DNA mutations, but a change in lifestyle can also alter the rate of DNA mutations. So unlike spontaneous mutations where nothing can be done, induced mutations can be reduced in your life by altering your lifestyle. What can be done if you do form cancer? The first thing that happens is typically a surgery. Surgery often starts with a simple biopsy. A biopsy removes a small portion of the growth for analysis, leaving the rest of the growth intact. The purpose is to simply test those uncontrolled cells, not to treat the cancer itself. Surgical removal of the tumor is then a possibility after the biopsy. Surgical removal of the tumor is the easiest and oldest treatment and is still the first option available to many people today. The idea is to either physically remove the cell or kill the cells by freezing them using liquid nitrogen or other source while they're still in the body. More invasive surgeries can remove all of the tumor, and this usually is accompanied by removal of a few lymph nodes as well. Lymph nodes are organs of the lymphatic system, or a system in an immune system in your body, and the lymph nodes act as sort of a filter of human body fluids. The reason why surgeons usually remove lymph nodes is because they want to remove the filters of the body to see if any cancer cells were trapped in these lymph nodes. If there were any cancer cells that were trapped, then they know that the cancer may have started to spread, and that's how they were filtered out of the body and brought into the lymph nodes. Determination of whether or not the growth has started to metastasize determines subsequent treatments. If the tumor has metastasized, then additional follow-up treatments may be required. But if there's no evidence of metastasis of the tumor, then surgery may be all that's needed. Additional treatments include chemotherapy, radiation therapy, and immunotherapy. Chemotherapy is a way of treating cancer using very toxic chemicals, the purpose of which is to kill actively dividing cells, including and especially cancer cells. Chemotherapy usually also entails severe and unintended side effects for the patient. Because it's killing actively dividing cells, it also tends to harm the bone marrow, hair follicles, nail beds, and GI tract, leading to anemia, a loss of hair or baldness, brittle nails, and an upset stomach, nausea, constipation, and other digestive tract issues. That's because all these areas of the body have actively dividing cells, which are also targeted by chemotherapy. Some chemotherapy drugs are simple pills you can take at home, while others are fluids that need to be obtained in the hospital using injections or IV bags. The first chemotherapeutic agent was mustard gas, first discovered in World War I as a possible treatment for cancer. It does help with cancer, but the results are generally only temporary, and the patient, of course, also experiences many negative side effects. Even today, doctors in medicine continue to use molecules that work similarly to mustard gas. These are alkylizing agents, and they're still used today in order to bind to DNA and destroy the structure of DNA, killing actively dividing cells. Newer drugs are what are referred to as antimetabolites, and they work not by destroying the DNA of actively dividing cells, but instead by weakening the cell, preventing them from taking in food and growing and dividing. There is a third group of these chemotherapeutic drugs, mitosis inhibitors, that include molecules like Taxol from the Pacific yew tree. It is a naturally occurring chemical that can alter molecules of the cytoskeleton or the cell structure, thereby, again, only targeting actively dividing cells and reducing the risk of negative side effects. Even better, though, to reduce the risk of negative side effects is to use radiation therapy. Radiation therapy today is a great treatment in that they can use laser beams to target specific regions of the body and not kill all actively dividing cells in the body like chemotherapy does. As a result, radiation therapy often has less side effects than the chemotherapy. The radiation only kills the cells exposed to the radiation itself, leaving the rest of the cells of the body intact. The newest form of treatment for cancer is immunotherapy. Immunotherapy, though only around 10 years old, has proven to be so successful that many hospitals are starting to use it extensively with their patients, depending on the kind of cancer they have. In this case, the patient's own white blood cells are removed from their body and selected to target the specific cancer that the patient has. This gets the patient's own immune system to target the cancer cells naturally. This minimizes the risky side effects even more, and it turns out is even more highly effective than radiation or chemotherapy because the immune cells can search all corners of the body looking for any possible trace of metastasized cancer cells. The only downside of immunotherapy is that it's new and very expensive. Hopefully, with time, it'll become more effective and even cheaper for many patients. In our last 5 minutes or so of lecture, in the next section, I'm going to be covering a very famous cancer cell line, the HeLa cells.